most common bone in a wrist fracture is the radius, which is this bone here. The other bone is the ulna, and sometimes you can get a little fracture of that as well. Initially, you try to pull it back into place and put a cast on it and see if you can get it to stay in the position it needs to be in to heal. But very frequently, if it's in a lot of pieces, that doesn't work. It's just too unstable.
And we were going to Lambeau Field, and we got there, and I was getting back up on the motorcycle and didn't make the kick over and fell backwards and broke my fall with my wrist.
She came in with a bad wrist fracture. Her distal radius was broken, it was in several pieces, and the break went into the joint.
It was more severe than we had hoped, or than I had hoped, and so it was going to require a surgery.
And although we tried splinting it for a little bit, it became obvious that we were going to need to fix it surgically. In the old days, they didn't have good ways to fix them, and they would just treat them all in casts. But they would be out of place and heal deformed and reduce the function of your hand. We now have technology where we can go in surgically and put plates and screws to restore the anatomy of the bone. And this allows them to not have to be casted as long and start motion sooner, so they get back to life sooner.
You know, we were very nervous when you wake up, you know, to make sure that, you know, everything worked and everything worked great. No numbness, no tingling, you know, normal, terrific.
With surgery, we were able to do an outpatient surgery, fix her wrist, put some plates and screws in it, get it nice and stable, and then she only has to be immobilized for 3 to 4 weeks and can start moving the wrist almost immediately after that.
Basically totally functioning. I can do anything that I was doing before. I laughed at I was just hoping I wouldn't have to be able to do push-ups or anything like that anymore, but I did get enough motion back to be able to do anything that I was doing before.
I'm very pleased with Susan's results. She did very well and she was a very good patient. What's good is she has medical background, so she was knowledgeable of the things that we needed to accomplish and what her role is in ensuring her success.